A woman wakes up. She prepares breakfast for her family. Then she goes back to work. She feels completely fine. No pain, no warning. But inside her, something is seriously not okay. Something is starting. A small silent change, glowing quietly. Weeks pass, months pass, until one day she feels a lump and everything else changes forever. Here is the truth that most women are not told. Breast cancer does not always cause pain. It does not always show obvious symptoms. It does not show symptoms early. That's why so many are diagnosed late. Hi, I'm Dr. Joshua Derito, a family physician focused on public health and cancer prevention and treatment. In this channel, we break complex science into simple, practical steps that you can use today, because things change when you take action. In this video, I'm going to share with you 7 early signs of breast cancer every woman must know. The hidden symptoms most women miss, and also exactly what to do when you notice any of them. Early detection is what will save your life or the life of someone whom you love. Let's look at the most common signs of breast cancer. A lump. According to the Center for Disease Control and Prevention, this is the most common sign: a new lump in the breast or under the arm. It is often hard, it can be irregular, and it is usually painless. Very important to know this. It is not every lump that is cancer, but every lump must be checked immediately. Change in size or shape of the breast. Watch for one of the breasts becoming noticeably larger than the other. Swelling or distortion of the outline or the configuration of the breast. Sudden change in the breast shape. These changes can happen slowly and they can be easy to miss. Skin changes in the breast. Carefully check the skin of your breast. You sometimes can see some dimpling. You see your breast looking like an orange peel. You can have redness or a rash or thickening or pitting of the skin of your breast. These are serious warning signs. Something deeper might be happening. You need to see your health provider. Sign number 4, nipple changes. Never ignore these changes in the nipple area. The nipple turning inwards. What is called in the medical profession the inversion of the nipple. It can be with pain, or there could be tenderness in the nipple area. You can also have a scaling or flaky skin around the nipple. These signs should prompt immediate action and medical attention. They could be warning signs. Do not delay. The 5th sign, nipple discharge. If you notice any fluid coming from the nipple that is not breast milk, and even if it's something that looked like breast milk and you are not breastfeeding, then see your health provider. Especially it is important if it is bloody, it is clear, or it occurs without you squeezing. Get checked immediately. Breast pain. Yes, sometimes they can occur with pain, but pain might be a red sign. So if you don't feel pain, it does not mean it is not serious. Any lump in the breast, please get checked. It could be ominous. Persistent pain or discomfort in the specific area of your breast is important that it is evaluated. Don't ignore pain that is coming to your breast. The most dangerous truth. This is what makes breast cancer especially dangerous. Sometimes there are no symptoms at all. That is why a mammogram is so important. It can detect cancer before you feel anything. The current guidelines state that from the age of 40, especially for the African women, start doing a mammogram. And earlier, if there is a family history of breast cancer in your family. So, early detection saves life. When breast cancer is found early, treatment is simpler, it's less aggressive, and survival rates are dramatically higher. When you can notice something before it is less than 2 centimeters, then you are almost assured that your survival for 5 years is more than 90%. Mammogram and clinical breast exams can catch cancer of the breast in the most early and treatable stages. The cost of waiting, the cost of not screening. Many women delay seeking for help because they feel they are fine, because they feel it is not painful, because there is no family history of breast cancer in their family. Please, from the age of 40, if you are a lady, start doing mammograms. Waiting can turn treatable cancer into advanced disease, which is harder to treat and has lower chances of survival. A mammogram, within 15 minutes, you are able to do it, and it will give you reassurance. Here is your simple action plan. Know you are normal. Become your breast aware by doing monthly breast self-exams. Be familiar with how your breast normally look and feel. And this will happen with consistent self-examination every month. So perform regular self-exams. Do them monthly. Then get screened from the age of 40. Follow the mammography guidelines, usually from 40 onwards every 2 years. Act fast. Any new change, see your health provider immediately. Do not wait. Now, as a doctor, many times I've seen this. Women who come early, they do mammograms, they survive, and they thrive. Women who delay, who ignore mammograms, can face harder battles. Early action changes everything. Right now, you may feel perfectly fine, but breast cancer can grow silently in your breast for years. Do not wait. Do not fear. Act on awareness. Go for the mammogram if you're above 40. Practice self-breast awareness. If you want to protect your health and get proper screening, visit Wellness Health Medical Services. We offer breast screening. We will teach you to become how to do breast self-awareness, and we will professionally evaluate you and support you. Call or WhatsApp the number on the screen, or visit our website at wellnesshealthservices.co.ke. Please share this video with every woman whom you love. It could be your mother, it could be your wife, it could be your sister or your daughter or a friend. It could save their lives. The earlier you detect breast cancer, the greater your chance of survival. And that chance starts with self-awareness today. Thank you for watching. I see you in the next video.